Gentlemen, let me ask you something. What if I told you there's a single spot on your body, no bigger than a coin, that when massaged for just 1 minute a day could naturally restore blood flow, reawaken sensitivity, and reignite the performance you thought was gone forever? I know that sounds unbelievable, maybe even awkward. But what I'm about to share is backed by centuries of traditional medicine and modern science. And it's helped hundreds of men in my practice reclaim their vitality without pills, procedures, or side effects. I'm Dr. Lila Romano, a board-certified urologist with over a decade of experience helping men restore their health naturally. Today, I'm going to show you one of the most powerful yet overlooked techniques for male vitality after 50. Before we start, hit that like button if you believe men deserve real, science-backed solutions. Comment below and tell me where you're watching from. I love connecting with men worldwide who are taking charge of their health. And subscribe because I share strategies like this every week to help you stay strong and confident after 50. Now, stay with me because you're about to learn exactly where this spot is, why it works physiologically, and the precise technique to use it safely. This 60-second habit could completely change how your body responds. Most men believe declining performance after 50 is just inevitable aging. They assume hormones are dropping, the body is slowing down, and there's nothing to do except accept it or reach for a pill. But here's the truth most doctors won't explain. Age isn't the real problem. The real culprit is chronic tension and restricted circulation in your pelvic floor, the network of muscles supporting your bladder, prostate, and sexual function. Think about how much time you spend sitting every day, driving, working at a desk, relaxing, on the couch. All of it adds up. Every hour you spend sitting, you're compressing and tightening the deep muscles in your lower pelvis, the very muscles that should stay flexible and responsive. Over years, these muscles become both stiff and weak simultaneously. Picture an old rubber band that's been stretched too many times. It's tight, but it's lost its snap. That's exactly what's happening inside your body. And this hidden tension does something dangerous. It compresses the blood vessels feeding your pelvic organs. It dulls the nerves controlling sensitivity and arousal. It creates a slow, steady decline in circulation to the areas that need it most. The result? Slower response, weaker function, less sensation, and often frustration, embarrassment, and quiet resignation that this is just how things are now. But here's what you need to understand. Your body can relearn what it's forgotten. When you release that tension and restore proper circulation, things change remarkably quickly. You sleep better. You wake up energized. Your body starts responding the way it used to, sometimes within weeks. One of the most effective ways to trigger that change is through focused stimulation of a specific area called the perineum. This small spot between your scrotum and anus might sound unusual, but beneath that patch of skin runs a dense network of blood vessels and nerves directly supplying your prostate, bladder, and erectile tissues. When you massage this spot correctly for 60 seconds daily, something powerful happens physiologically. You signal those compressed blood vessels to relax and expand. You tell those tense muscles to release. You reactivate nerve pathways that may have been dormant for years. This isn't New Age nonsense. Traditional Eastern medicine has used this technique for centuries, calling it the million-dollar point because of its profound effects on male vitality. Modern science now explains exactly why it works. When you stimulate this area, your body releases nitric oxide, the same molecule medications try to amplify artificially. Nitric oxide is the master key to vascular dilation. It tells your arteries to open wide, allowing blood to flow freely into the tissues that need it most. You might think, this sounds awkward. Should I really be doing this? Let me address that directly. There's absolutely nothing strange about taking care of your body. This is anatomy. This is physiology. This is you taking control of your health naturally. The goal isn't pleasure. The goal is recovery, restoring the function and vitality that tension and poor circulation have stolen from you over the years. I had a patient named Robert, 64 years old, who'd given up on intimacy completely. He felt frustrated and disconnected. After 3 weeks of consistent practice with this technique, he came to my office with quiet confidence I hadn't seen before. His body was responding naturally again. "It's like my body finally remembered how to work," he told me. That's what happens when you address the root cause instead of masking symptoms. Now let's talk about exactly how to do this, step by step, safely and effectively. The area we're targeting is the perineum, that soft tissue between your scrotum and anus. Underneath runs a critical network of blood vessels, nerves, and muscles controlling erections, bladder function, and prostate health. When you apply gentle, targeted pressure here, you directly influence these systems. Here's the exact protocol. Step 1. Get comfortable. Either sit on the edge of a chair with knees slightly apart, or lie on your back with knees bent and feet flat. The key is relaxation. If you're tense, your pelvic muscles stay clenched and you won't get full benefits. Step 2. Locate the spot. Using your index and middle fingers, gently press the soft area between your scrotum and anus. You'll notice it feels slightly more tender or sensitive than surrounding tissue. That's completely normal. That tenderness means you've found the right place, directly over the bulbospongiosus muscle and the network of vessels and nerves we're targeting. Step 3. Apply proper pressure. Use firm but gentle pressure, about the firmness you'd use checking if a tomato is ripe. You should feel the tissue beneath your fingers, but never pain. If it hurts, ease up. Step 4. Choose your massage technique. You have 3 effective options. Option A is circular massage. Make slow, deliberate circles. Go clockwise for 30 seconds, then counterclockwise for 30 seconds. This stimulates blood flow in all directions and gently works underlying muscles. Option B is press and release. Press firmly for 5 seconds, release completely, repeat. This pulsing mimics natural blood vessel pumping and works well if constant pressure feels uncomfortable. Option C is gentle pulsing. Use light up and down or tapping motion, like gently knocking on a door. This rhythmic stimulation activates nerves without overstimulation. The principle is the same across all methods. You're not forcing anything. You're reminding your muscles to relax and your blood vessels to open. You're waking up a system that's been asleep. Step 5. Enhance with natural oil. This step is optional, but highly recommended because it improves both comfort and results. Oil reduces friction and delivers therapeutic benefits through the skin. Castor oil penetrates deeply, improves circulation at the cellular level, and has natural anti-inflammatory properties. Excellent for chronic pelvic tension or prostate discomfort. Coconut oil is gentler, perfect for sensitive skin. It's naturally antibacterial and contains fatty acids supporting healthy hormone production. Black seed oil has been treasured for thousands of years for balancing testosterone, reducing inflammation, and supporting male vitality. Whichever you choose, warm it between your palms first. Cold oil on sensitive skin causes discomfort and muscle tension, defeating the purpose. Step 6. Optimal timing. When you do this matters almost as much as how. Morning option, within an hour of waking, when testosterone naturally peaks. This sets a positive tone for the entire day, better energy, clearer thinking, more natural arousal. Evening option, 30 to 60 minutes before bed. This helps your body relax, releases daily. Tension and supports overnight recovery. Many men find evening practice leads to better sleep and stronger morning function. Here's critical, 1 minute is enough. Don't overdo it. Consistency matters far more than intensity. 60 seconds daily produces better results than 10 minutes once weekly. Your body responds to regular, repeated signals, not sporadic, intense efforts. If this is your first time, you might feel uncertain or self-conscious. Completely normal. Most men tell me they feel awkward initially, but once they understand this is legitimate medical self-care, they relax into it. Within a week or 2, it becomes routine like brushing teeth. What many men notice within those first weeks: deeper, more restful sleep, a lighter feeling in hips and lower back, better bladder control, especially at night, a subtle but unmistakable sense of calm they hadn't felt in years. These are signs that circulation is improving, tension is releasing, and your body is remembering optimal function. I had another patient, James, age 70, dealing with chronic lower back pain and 3 nightly bathroom trips destroying his sleep. I taught him this technique to practice every evening before bed. 2 weeks later, his back pain had significantly eased and bathroom trips dropped from 3 to 1. After a month, his energy and mood had dramatically improved. He told me, Dr. Romano, I didn't realize how much tension I was holding until I finally let it go. That's exactly what this does. It helps your body remember balance. Now let me explain something important, because many of you have tried other solutions. Maybe medications, maybe supplements, and perhaps they worked temporarily or didn't work at all. Let me explain why so many men feel stuck in a frustrating cycle and why this natural approach works where others fail. Here's what most men get wrong trying to improve performance. They chase quick fixes. They think a pill will solve everything, that one prescription can restore what years of tension and poor circulation gradually took away. But that's not how the body works. Pills force blood flow temporarily. They override your natural systems and artificially create an effect. But they don't teach blood vessels to stay flexible. They don't retrain nerves to fire properly. They don't address underlying muscular tension, restricting circulation. Once the chemical effect wears off, and it always does, you're back where you started. Sometimes worse, because your body begins relying on that chemical shortcut instead of doing the work itself. This is why so many men feel trapped. They get short-term results, but deep down, nothing actually changes. Confidence doesn't truly return. Stamina doesn't last. They still feel disconnected from their body, depending on something external just to function. The reason is simple. You can't fix a mechanical problem with a temporary chemical push. If blood vessels are stiff and pelvic muscles chronically locked, pills won't rebuild flexibility or restore coordination. They just mask symptoms. That's where this massage makes profound difference. It works with your body, not against it. It retrains muscles to release tension naturally. It improves blood vessel elasticity over time. It strengthens nerve pathways controlling sensation and arousal. The change builds gradually, but results last because they're natural and sustainable. Your body remembers how to respond because it's doing the actual work. Think of it like exercise. First few days, you might not notice dramatic changes. But staying consistent, your muscles adapt. Your cardiovascular system improves. Energy increases. Same principle here. There's another factor men completely underestimate: stress. When you carry constant pressure from work, relationships, finances, your nervous system stays locked in fight or flight mode. Blood flow to pelvis decreases. Muscle tension builds. Performance suffers directly. This massage helps reverse that pattern. It signals your nervous system it's safe to relax. Combined with deep, intentional breathing, stress hormones drop, heart rate steadies, and your body shifts into repair mode. That's when healing happens. This is why timing matters. Evening practice before bed gives your body all night to recover in that relaxed state. You wake refreshed, circulation stays improved, muscles remain relaxed for hours. Morning practice, when testosterone peaks, sets a powerful tone for energy and confidence carrying through the day. Men who see the biggest, most lasting changes aren't the ones doing this perfectly. They're the ones staying consistent. 1 minute daily. That's all. Over time, that single minute reshapes how your entire body feels and functions. I treated Daniel, age 65, who'd been medication dependent for years. He'd lost trust in his body completely. We started this daily technique plus simple lifestyle changes: more walking, regular stretching, staying hydrated. By week 4, Daniel hadn't taken a pill in days. His body was responding naturally. His confidence returned. But what struck me most was when he said, "It's not just physical. I feel lighter, calmer, like I've reconnected with myself." Let me show you how to make results even stronger by adding 2 simple habits that multiply benefits. First habit: movement. Your pelvic floor is a network of muscles, and like every muscle group, it thrives on regular motion. Sitting all day is the absolute enemy of healthy circulation. Every hour sitting is another hour of pressure building, compressing blood vessels, dulling nerves. Add short walks after meals, even just 10 minutes. These brief walks boost blood flow throughout your body, help lower blood sugar, protecting vascular health, and keep small blood vessels in your pelvis flexible and responsive. You don't need a gym. Your body simply needs regular movement. When you combine this massage with consistent daily walking, you send your body a powerful double signal to heal and stay open. Second habit, intentional breathing. Deep, slow breathing isn't just calming, it mechanically drives circulation. When you breathe deeply, your diaphragm moves down and gently massages internal pelvic organs with every breath. That rhythmic motion improves oxygen exchange, relaxes the same muscles you're targeting with massage, and shifts your nervous system from stress mode into recovery mode. Here's a simple technique to try right after your massage. Sit comfortably and take 5 slow, intentional breaths. Inhale slowly through your nose for 4 counts. Hold gently for 2 counts. Exhale slowly through your mouth for 6 counts. That's 1 cycle. Do 5. It's not just meditation. It's mechanical support for circulation. That gentle diaphragm motion restores nervous system balance and deepens blood flow to your lower body. When you combine all 3, massage, movement, and breathing, you give your body everything it needs to stay strong, responsive, and healthy. Completely natural. No drugs. No side effects. No external dependency. Just you, your awareness, and daily consistency. I've watched this combination transform lives. Men in their 60s and 70s who felt drained suddenly rediscover confidence they hadn't felt in decades. Energy returns. Sleep improves. Relationships come back to life. Not because they found a magic solution, but because they learned to give their body exactly what it needs to function naturally. Let's talk about realistic expectations and timing, because I want you going into this with clear, honest understanding. This isn't overnight magic. Your body needs time to adapt, to relearn patterns, to rebuild flexibility and responsiveness that years of tension gradually diminished. But the timeline is actually quite encouraging with consistency. First week, many men notice subtle but meaningful changes. Better sleep quality, more stable energy, sometimes reduced nighttime bathroom trips. You might not feel dramatic difference yet, but your body is absolutely beginning to respond. Weeks 2 through 4, improvements typically become much more noticeable. Stronger desire, firmer morning function, better bladder control, overall sense of vitality and confidence returning. These aren't coincidences. They're direct signs circulation is improving and your nervous system is recalibrating. Between 4 and 12 weeks of consistent daily practice, most men report significant, lasting improvements. Performance and confidence return. Energy stabilizes. Mood lifts. Some men notice additional benefits like modest weight loss, improved cholesterol, urinary symptoms easing more reliably. The key word is consistent. Practice daily. Give it at least 30 days, preferably 3 full months, before deciding whether it's working. Your body is relearning patterns that took years, sometimes decades, to develop. Give it the time it needs to remember optimal function. Gentlemen, I want you to understand something clearly. Your body is not broken. It doesn't need rescuing by external force. It simply needs reminding of what it's always known how to do. Every man watching right now has the inherent ability to restore his vitality. The power isn't in a pill bottle. It's not locked in expensive treatment. It's in your daily habits. In those quiet moments where you consciously decide to take care of yourself instead of waiting for things to worsen. Here's my challenge. For the next 3 weeks, commit to just 1 minute daily. Use this massage technique. Move your body a little more. Breathe with intention. That's all. Most men notice meaningful results within the first few days. By week 3, those changes often feel permanent. Better circulation, calmer energy, genuine confidence from deep within. Before you go, remember this. It's never too late to reconnect with your body. You're not too old. You're not too far gone. Your health, your strength, your energy, they're all still there inside you, waiting for you to claim them again. If this message gave you hope, hit that like button right now. It helps other men discover this truth. Subscribe if you haven't already, because I share real, science-backed solutions like this every day to help men over 50 stay strong, confident, and in complete control of their health. I'm Dr. Lila Romano, and I will see you in the next video.